Howdy folks, Dr. Ed here with Total Body Healthcare, and I've got your Whiteboard Wednesday thought of the week. Parents with kiddos still at home, this video this week is for you. Grandparents, if you're still involved in actively raising your grandkids, this video is for you as well. I want you to do a little self-reflection today, maybe some self-evaluation. I want you to look at your overall health picture, what your health looks like right now, and ask yourself if you're happy with what you see. Now, I know that you think, since I'm a chiropractor, I'm asking about joint pain or muscle stiffness or anything like that, but I actually want you to go a little bit deeper than that. For instance, are you on any prescription medications for chronic conditions, maybe like cholesterol or high blood pressure? Here's a good question for you. Are you satisfied with taking those medications for the rest of your life? Are you satisfied? Are you happy with the trajectory that your health is currently taking? Here's the real question. Do you want your kiddos to deal with the same types of health issues that you're currently dealing with? It's not a genetic issue. We're going to go into that here in just a minute. It's not because of genetics. Let me give you an analogy that chiropractors have used for years. We have used the car front end alignment, or maybe misalignment, if you will, and then what that causes as far as the uneven wear on your tires as an analogy to describe the decay and degeneration that takes place in the bones of the spine when it is out of alignment. It's a great analogy for that. You certainly don't want that decay and degeneration in your spine, but I want to take the analogy a little bit deeper. So here's the analogy. You go to the tire store and you buy a new set of tires for your car. Pulling out of the parking lot, you notice, hey, the handling of your car is better. It's a nice, smooth ride. Immediate improvement. You notice that, and you're pleased with your purchase. So you head on about your day. Next day, you get in your car, you start driving. Same thing. Nice, smooth ride, good handling. You're still pretty pleased with this. Several days pass, and the nice ride becomes your new normal. Then, one day, bam, you hit a pothole pretty hard. Thankfully, you don't get a flat tire from the pothole, so you continue on your way, and pretty soon the pothole is a distant memory. Several weeks pass, and as you're driving on the interstate, you notice your steering wheel has a slight little shimmy to it when you hit interstate speeds. Maybe you notice it, maybe you don't. If you do, as soon as you get off the interstate, the shimmy goes away and you forget about it. That is until the next day when you hit the interstate and you hit those interstate speeds and you notice that shimmy. And you begin to think, wow, that's kind of odd. Several weeks of this shimmy at interstate speeds, and it now kind of feels normal to you. Then one day, you feel that shimmy at maybe 45 miles an hour as you're just driving on a surface street in your neighborhood. And your brain goes, well, that's odd, but quickly forgets about it. Now the shimmy in the steering wheel, anytime you go over 45 miles an hour, you don't even notice it. It has become your new normal. Fast forward several weeks or maybe even months, and for some reason, while you're driving, you let go of the steering wheel. You know, maybe you're reaching for your coffee or something like that. You let go of your steering wheel, and immediately the car starts to pull to the left. Again, your brain goes, that's odd, but we're all leading busy lives, and the pull to the left is quickly forgotten. Your car pulling to the left whenever you let go of the steering wheel becomes normal, and eventually you notice that you actually have to turn the steering wheel slightly to the right to maintain a straight direction of travel for your car. At this point, you know something is not functioning correctly with the steering and handling system of your car, but hitting that pothole, it's a long gone memory. Finally, one day as you're walking out to your car, maybe at your house or you're leaving from a store, and you look down at the tires, and you notice that uneven wear. One side's definitely worn out more than the other side of that same tire. You look at the other side, the other front end tire, same thing. One side is worn out more than the other side. Now you decide to get the tires checked out. So back to the tire shop you go, and you get the diagnosis that your front end is out of alignment, and it has been for quite some time. So how does this relate to our health? The uneven wear in the treads of your tires is what eventually got you to seek help to figure out what was wrong with your car. This is analogous to the symptoms that our bodies develop after not functioning correctly for an extended period of time. We tend to ignore the small symptoms, such as a shimmy in your steering wheel, and only seek help when symptoms become more obvious. One of the problems with this level of thinking is that it might be a little too late at that point. For instance, statistics show that 40% of first-time heart attack victims reported no symptoms of heart disease prior to that heart attack. In other words, their tires weren't showing any uneven wear on the treads yet, but I guarantee you their steering wheel had a little shimmy to it. They either ignored the early symptoms or maybe they didn't know those symptoms were related to heart disease. Now, please, don't get hung up just on heart disease. All chronic health conditions fit into this analogy. You see, the key word is chronic. These chronic health conditions did not develop over a short period of time, just like the wear on your tires didn't happen overnight. Remember that pothole many months ago? The chronic health conditions adults deal with started to develop years before the symptoms develop. So again, I ask you, what do you want your children's health future to look like? Have they hit any potholes yet in their young lives? For that matter, what are the potholes that affect our health? If you've been in the office for any length of time or followed us on social media, you can probably guess that these potholes are the three stresses that we deal with all the time: physical, chemical, or emotional stress. Another way to think of them is the three T's: thoughts, traumas, or toxins. And I know what you're thinking. We all are exposed to negative thoughts, chemical traumas, chemical toxins, physical traumas our whole life, and you'd be correct. It's not the amount of three T's that your kiddos and yourself have been exposed to. It's whether or not your body can adapt and overcome the challenges the three T's put on our system. So the question is, how do we adapt and overcome to the challenges of the three T's? By having a fully functioning nervous system. You see, at its most basic function, our nervous system job is to detect and react to the stresses that we come up against in our environment. If we don't detect to these stresses in a timely manner, they cause our bodies to begin to malfunction, and they cause a little shimmy, if you will, in our steering wheel. Your little ones always seem to have a running nose. Maybe they catch every little bug or germ that comes around. Their nervous system isn't detecting the germs and bugs that are all around us all the time, and therefore not alerting the immune system that, hey, the immune system needs to kick in and work. Maybe you know a child that has sensory processing issues. Again, their nervous system isn't filtering out what should be normal everyday signals from our environment. When this happens, their brain can't properly respond to those signals. This breakdown in communication between the brain and the body is called a subluxation, and it occurs in the neurospinal system. Subluxations occur when the body doesn't properly detect and react to the three T's in our environment. Subluxations can cause a myriad of symptoms, which is why I ask you to dig a little bit deeper into your health evaluation at the beginning of the video. Subluxations don't always cause back pain. As a matter of fact, most of them don't cause back pain. If you'll notice again, I didn't say it was the volume of the three T's someone is exposed to that causes the subluxation. In our tire analogy, it was just one pothole that started the cascade of events leading to the uneven tire wear. However, we would all have to admit that we hit potholes all the time, right? It would be impossible to avoid all potholes in our roads, and likewise, we can't avoid all the three T's in our lives all the time. So what are we to do? As I said, the basic job of the nervous system is to detect and react to the three T's. Regular, consistent, neurologically focused chiropractic care has been shown to improve the resiliency of the nervous system, which allows it to detect and react more efficiently. In essence, it's like upgrading the suspension on your car. Yes, of course, the more potholes we can avoid, the better our car will drive, and the same is true for our health. By reducing our exposure to the three T's from our environment, we will be healthier. But having a more efficiently functioning nervous system, when we do hit a pothole, our bodies will detect and react to it quicker. So here's the great thing about regular chiropractic care for kids. Their nervous system has more neuroplasticity and has not been beaten down by years of exposure to the three T's. Therefore, chiropractic adjustments help train their nervous system to function properly from an early age. If you want to positively influence your child's health future, I suggest getting them under regular, neurologically focused chiropractic care. I'm Dr. Ed with Total Body Health Care, and there is your Whiteboard Wednesday Thought of the Week.